So here are the 5 predictions. Number 1, Copernican consumer. Consumers will become the center of their own health universe more than ever before, enabled by sensors, AI, and other technology, as well as services geared toward empowering them. Number 2, constricted consumerism. While consumers will become increasingly responsible for their own health and use of healthcare services, they will actually become less and less empowered in the choices they have for care, especially in higher acuity, higher cost situations.
Hello, healthcare. You were just hearing from Chris Bevolo, the Chief Brand Officer at Revive, and also the author of Joe Public Doesn't Care About Your Hospital. Chris was discussing his new book, Joe Public 2030, where he and leaders from Geisinger, Intermountain Health, CVS, Johns Hopkins Medicine, and many others got together and discussed what the next 10 years of healthcare strategy are going to look like. We sat down with the Forum for Healthcare Strategists to discuss this book and his predictions. Here's what's coming up next in that conversation. First, we're going to focus on his Team 2030 and how they generated these predictions and validated them. Then we're going to go deep into what those predictions actually are, and the entire time you'll be hearing discussions, comments, and feedback from the healthcare leaders, healthcare marketers, and healthcare strategists from the forum. With that, I hope you enjoy that conversation, and I'm going to hand it over to Chris.
Chris, thank you for that setup. We're going to try to get through this upfront part as quickly as possible. I think, as Chris mentioned, it is really important that you get a chance to understand how this was developed, why it was developed, because that lends validity to, I think, the things you're going to hear. And also, I think will allow us to have a better, more thorough conversation. So real quickly, where did this come from? Chris talked about this at the outset. It is the 10-year anniversary. And as we approached 2021, we thought, what are we going to do with the 10-year anniversary of that first book? We've had a couple come out in the series since then. And we thought, heck, it's been 10 years. Why don't we do a 180, look forward 10 years and see what we can find? So Chris alluded to this. We took about 3 months to develop these predictions. We really started with a blank slate. We did not set out to prove any hypotheses necessarily. And there's one prediction in particular that I can talk to you that I think proves that point. We picked a team, we called them Team 2030 from Revive. So this was a intentionally diverse team in terms of age, experience, gender, race, you name it. We try to create a really nice collective of folks to think as thinkers and futurists. We poured everything we knew and everything we could find onto a table. It was during COVID, so that table happened to be Miro, if you're familiar with Miro. If you saw a picture of our Miro board, it's kind of nuts, all the different things that were on there. But we just really wanted to get everything out that we could think of related to everything from the marketing of hospitals and health systems all the way up through the industry to even societal trends, because we think those are really important to understand. I'm going to talk about some of the resources that we leverage. Chris alluded to those a second ago, but the book ends up having more than 260 citations in it. So you can get a feel for how many different things we brought to bear to really support the thinking here. The other thing that's important to note and to give credit to is Rohit Bhargava. If you're not familiar with him, he runs a company that puts out predictions in terms of business and society pretty much every year. In 2020, I think it was his last book, Non-Obvious Megatrends, he actually shared the process that his team goes through to look at predictions, to start as widely as possible and then call those down. He calls it the haystack method. So we adopted that, and we use that, Team 2030 used that to really figure out how do we sort through the 1,001 things that were in front of us to get to the point that you're going to hear about today. Again, Chris alluded to this. I think one of the coolest things about this is we had a chance not only to leverage the super smart people in our agency, but we talked to 22 industry leaders from across healthcare. So for example, we had the privilege of talking to the CEO of Geisinger, the CEO of Henry Ford Health System. We talked to the head of health investments at Bain Capital. We talked to the head of brand at CVS Health. We talked to some really smart people, and their input and their feedback had a lot to do in shaping the predictions you're going to hear, as well as validating a lot of what you're going to hear. We also, provide different perspectives because not everybody agreed with where we ended up, and we don't expect all of you to agree either. That's not really the point. The point is to drive conversation and debate. But I think, again, it just lends a lot of credibility to what we're about to say. As Chris said, this was not me. I get all the credit because my name's in the book. I had the privilege of working with this amazing team and talking to these amazing people to pull these ideas together. So I think that's really important to emphasize. All right, one last thing, and then we'll get to the predictions. So you're going to hear 5, as Chris mentioned. These were the 5, again, that emerged from our process. They're built on 20 foundational trends. So for example, we didn't set out necessarily to say, what's the future of value-based care, right? But that is a critical trend we have to understand if we want to understand the next 10 years. So we lay out those foundational trends at a very high level in the book. It's not a place to go if you want to learn everything you need to know about value-based care or AI. Thank goodness Chris is on the call with us. So if you get any questions about AI, I'll be the first to admit I'm not an AI expert, but we have enough background in there to understand how these trends will impact the predictions that you're going to hear. It's important to know these predictions are not meant to be comprehensive. This is not a full picture of 2030. In fact, some of these predictions may feel a little bit contradictory to each other, which makes them interesting as well to think about how they might intersect. But they really are intended to kind of stand on their own. And so again, our point was, how do we pull this forward to really drive the conversation we want to have and need to have as an industry? Some of these predictions are great. They're going to get you excited. Some are going to make you think, oh, bleep, is that really what's going to happen? It's up to us to make the future we want. And even if some of these may sound negative or problematic, we got to put that on the table. We got to have that conversation and figure out, as individuals, as organizations, and as an industry, where do we want to go? And the last thing I'll say is, in each case, all of these predictions are already underway. The question isn't really, will these happen? The question is, to what degree will they happen and by when? So I'm going to read you a very high level description of each of the 5 predictions that you see up here. Based on that, we're going to ask you to vote. We're going to ask you to vote for the top prediction you want to hear. And knowing we've got enough people here on this call, we will then use that as a priority of how we walk through these so that we can have a decent conversation. And as Chris said, we may only get through. It depends on how deep that conversation goes. But maybe if we don't get through all of them, we can come back and do the rest at some point. All right. So here are the 5 predictions. Number 1, Copernican consumer. Consumers will become the center of their own health universe more than ever before, enabled by sensors, AI, and other technology, as well as services geared toward empowering them, leading to profound implications for both consumers and healthcare organizations. Potential results could include a dramatic reduction in the need for primary care clinicians, an entirely new sector devoted to personal health management, true precision medicine combined with health management, and more. All right, so that's the first one. Number 2, constricted consumerism. While consumers will become increasingly responsible for their own health and use of healthcare services, they will actually become less and less empowered in the choices they have for care, especially in higher acuity, higher cost situations. While many in the industry will continue to sing the praises of choice, the reality is most consumers will have far fewer choices moving forward, often in ways they might never ever consider or see. All right. Number 3, the funnel wars. Today, we tend to consider hospital and health systems as birds of the same feather in terms of business model, with variances based on size, scope of services, for-profit or nonprofit. Moving forward, we could see the splitting of the healthcare system model, with some systems moving even further to the larger, more comprehensive health organizations, others retracting into solely acute care destinations, what one person called the giant ICU on a hill, and others somewhere in the middle. These models may emerge based on core geographic or market differences, such as presence of competitors, plan consolidation, regulation, and dozens of other market forces. Yet the primary area where this transformation will play out is with health, wellness, and the lower acuity care points. That's the top of the funnel, and that's why we call it the funnel wars. All right, number 4, the rise of health sex. Challenges to and skepticism of the mainstream medical field and science itself have exploded in the past 2 years because of the pandemic and political tribalism in the US. Anti-vaxxers, non-maskers, and COVID deniers are just the start of an expansion of the distrust of experts, which taken to its potential end could result in multiple health sects, primary schools of medical thought that coalesce around a political or worldview. Imagine mainstreamers who follow the established healthcare point of view, progressives who follow minimal medical intervention combined with complementary and alternative medical solutions, or contrarians who deny mainstream medical thought and create their own set of alternative facts on everything from vaccines to childbirth to end-of-life care. These sects will not only follow the medical thinking that best fits their worldview, they may in fact create their own reality through alternative research, diagnosis and treatment approaches, and models for the delivery of care itself. And finally, disparity dystopia. The COVID-19 pandemic shone an ugly light on the disparities that have plagued the US healthcare system for decades. Unfortunately, that health gap is more likely than not to expand as the haves gain access to increasingly more expensive medical treatments, health services, and personalized care, while the have-nots will face growing shortages of basic health resources, from clean water and air to physicians and clinicians, rural healthcare, and more. This shift will be compounded by the mental health crisis, which disproportionately affects systemically disadvantaged populations and groups outside traditional healthcare access channels, such as teens. All while those entities that might address these disparities increasingly struggle financially, such as health systems or state and federal governments, and others lack the incentives to focus on this growing issue. All right, so there are your choices. Let's open the poll, give people a chance to vote. And then depending on where we land, Chris, you're gonna help me keep track of where we land. Once we land on one, what I'm gonna do is we're gonna dive a little deeper, as we said. All right, let's give them like 3, 2, 1.
So we got 71% population. Hopefully that's representative of what people want the most. But we have our marching orders, Chris, which is to start with constricted consumerism.
All right, let's do it. We're going to jump right to that. And again, what I'm going to do is I'm going to read, again, I'm just being very transparent. There's too much here to memorize, but I will read you a narrative that we think captures the spirit of this. And then again, point out some highlights of it, and we'll then dive into the combos and the questions. All right. So let's go with constricted consumerism. Imagine it's 2030. You're me, a 50-something, working at a great gig with an employer who offers a generous health insurance allowance. Like many companies, mine stopped offering health insurance through work a number of years ago, thanks to changes in how health benefits are considered from a tax standpoint. Now I take my allowance and head out to the market to find insurance on my own. My plan will make me pay through the nose if I use any healthcare outside of my network. And they insist all urgent primary and diagnostic care starts with their own clinicians, using their own urgent care clinics and virtual care offerings. From there, if I need more care, my plan will tell me exactly where to go based on whatever is the least expensive option given certain standards of quality. Of course, there really are only 2 games in town anyway. Like most markets, mine has seen provider consolidation so that there are really only 2 health systems that provide the full continuum of care. And once I engage with the provider for any reason, they fight like mad to keep me within their system for any additional care, with automatic referrals and appointment scheduling. Both local systems are included in my network, but my plan typically dictates which I use. Of course, with my $25,000 deductible, I could spend out of pocket for the low cost care I need from places like Dollar General or Amazon. I can remember not too long ago when I had so many more choices for my care, but today, even though I'm spending far more money out of pocket, it feels like there are only a few ways I get to choose. But that's okay. Healthcare has become so complex anyway. Who has time to figure out what's best for themselves on their own? Just tell me where to go and I'll go. Welcome to Prediction 2, the world of constricted consumerism. So this is super interesting because this is the one that I said at the beginning. If we had set out to kind of with a hypothesis and then wanted to prove it and put it in the book, we would have had the opposite answer for consumerism. I have been talking about consumerism so long. My joke is that when I first started doing presentations on it, I used to use a picture of my daughter as a toddler. And it was one of those classic pictures where she's in her high chair. She's got spaghetti all over her face. She looks kind of like not happy. And I would say that's what the healthcare consumer feels like when they have to wait an hour to see the doctor, or when they pick up a copy of Golf Digest that's 10 years old, or they can't even find a place to park, right? Well, the joke about that is that daughter, Callie, just graduated from high school this last summer. So that's how long I've been talking about consumerism. You can see the quote here from Wendell Potter, who is an expert in this. He goes into more colorful language in the book about what he thinks about consumerism. And so the point of this is we've been waiting for the real impact of consumerism to hit for 20 years. And from talking to our experts and the research that we've done, what we're saying is not only do we not expect it to really hit in ways that we would want moving forward, particularly related to choice in higher acuity settings, we actually think this could get worse. And so here's some ways to think about this. I've already kind of talked about how long that we've been waiting, and yes, there's been some incremental change, but when you really dig into it, consumerism has not hit near to the degree that a lot of people thought it would. One of the great things we heard from the experts we talked to, and this was a new perspective for me, was the reason why consumerism hasn't delivered all the promises that we thought it would have is because we're talking about the wrong consumer. When we talk about consumers, we talk about individuals, those of us out in the public receiving care. And the idea was that, by spending our own money and having access to more choice and having more information on those choices, we would drive the changes in healthcare that we would want to see to our benefit: more access, lower price, transparency, all those great things. Well, the reason that hasn't come to fruition is because the actual most powerful consumer in healthcare is not individuals. It's those who pay the bill, and we don't pay the bill as much as we think we do, right? The biggest payer of healthcare expense in this country is the federal government through Medicaid. It's employers, it's health insurance companies, it's public payers in terms of the federal government primarily, who are the ones that are the true customers here. And if that's the case, then it helps us understand why they're the ones that drive the changes that most influence healthcare rather than the individual consumer. It helps explain why I can't drive 4 hours north to get cheaper drugs in Canada, why I'm not allowed to do that. It helps explain why we have things like PBMs, which are like incredibly complex, weird things that really aren't here for us. Some of us may benefit in some ways, but they're not for us, right? And so that was a really powerful insight that came through in talking to people. We know that payers are going to be payers. We know insurance companies really try to restrict. That's part of their job, right? Is to limit costs. And so you see people going through tiers, they're steered. Now you have folks, all of the major health insurers are integrated in some way in terms of providing care now, and in different ways. But of course, you've got the largest health insurer in United, also happening to have the largest provider in this country. If you measure health systems in terms of the number of employed doctors, Optum is the largest health system in this country with over 55,000 doctors, right? And so these folks are really trying to guide people to their own care before they go to the legacy hospitals and health system. Providers aren't off the hook here. Consolidation certainly limits choices. We all have read about the closing of hospitals in rural areas and the difficulty of having access there. It's true in some inner cities as well. Health systems don't always play ball with things like transparency. We see that in people being dragged kicking and screaming to have their prices in a transparent way on their websites. Many of them still not doing that, holding out that will change. And so all of that is really oriented to making it more and more difficult for us as consumers to choose where we want to go. It's going to be chosen for us in most cases. And the final point of this is consumerism was always predicated on the idea that we as consumers could act in our own best interest. Well, that assumes we have access to all the information we have. We understand how the system works. And I think most of us, if you've experienced the healthcare industry in any way as a patient, can speak to the fact that it is very difficult to navigate this on your own. Most consumers are nowhere near equipped in terms of understanding what they need to do to advocate for themselves, to pick the best choices, all of those things. So even if we look to ourselves, it's very similar to how we think about retirement. Most of us are not equipped to invest for ourselves in a smart way, which is why we have financial planners and all of that. So that's kind of the final nail in this coffin, if you will, about why we see consumerism becoming more constricted. So I'm going to stop sharing, Chris, so we can have some convo on this.
Great, because there's a lot of convo to be had. I don't know if you've seen the
No,
chat.
I can't keep up with it.
Yeah, lots of great conversation. I want to just, first of all, I want to thank you Jim, Barbara, Deborah, Alan, Zachary for getting in on this discussion, and all the names that I missed as well, Catherine. And one of the key themes that I'm seeing in the questions that we're getting are around the relationship between this constricted consumer concept and other things, such as Jim pointed out a relationship between the Copernican consumer and the constricted consumer. Alan pointed out things like the insurance industry, which Sanjay had comment on as well. But what I want to start with, we got a direct question from Jake Poor, which was, like many, I'm concerned about the current nursing shortage and those who are planning to leave soon. So just with this basic concept of the shortages that might exist within 2030 on the supply side, how do you relate that or see that in relationship to the constricted consumer?
Yeah, I mean, certainly the really, really desperate situation the industry finds itself in right now in terms of workforce issues, driven primarily by COVID, but also related to that, the burnout from COVID, clearly the great resignation and in the ways you might interpret that related to this, that will have at least a short-term impact on this. It feels like it's a little bit incidental is a terrible word to use. It's nobody's fault that we're really going to face more of a constricted option in this regard, because nobody wants this situation. Everybody wants to be able to provide whatever care they can to the fullest capacity they can. The trick with the other aspects of constricted consumerism is they're intentional. So they're, insurance companies intentionally restricting our options, or providers doing that. That's the trickier thing to deal with. Let's all hope that within the next few years, we can emerge from the crisis we have, and maybe technology will help us in that regard. But I also think it's fair to say this is not a short-term issue in terms of workforce. It's not something that once COVID ends, which God help us all, is this year, hopefully we're coming out of it, and Omicron is the last Greek letter that we're going to have to remember. But even if that's the case, the workforce shortage is not going to be solved in a short term, but hopefully in a couple of years it will be. But that won't change the trajectory overall. That's how I'm seeing it, Chris. I don't know if you've got thoughts.
Well, one thing that I wanted to just for the limited time, that there was another question that came in from the audience that was related to discussion, which this one came from Catherine Harrell. And it was boom. So maybe I'll focus on consumerism, which like everybody in this room has probably been exposed to some elevation in focusing on consumerism in some kind of way. But maybe that focus is to help them and us feel better about being constricted. And that leads to something that we were talking about beforehand, which is that idea that with a future of more constructed consumerism is part of what you're saying, that hospitals and health systems, like these efforts that we're talking about, should there be any kind of effort to deprioritize those because that was focused on wooing patients who might not have as much of a choice anyway? What happens to those initiatives and priorities? How should that focus shift if to be true?
Of course, Catherine, that's coming from you. A great question. I know Catherine really well, and that makes me laugh. It makes me think of this was years ago, maybe 10 years ago, working with a hospital that was going through an expansion, and they really wanted to get out there and get community feedback on what the patient experience should be like and how they design the environment. And after like a town hall, the CFO in an internal meeting said, "Why are we even doing this? We could stick these people in the hallway and they're still going to come." And which makes you just sit back and kind of gasp, right? But that fits with the idea of constricted consumer. After all, if the only choice is you and one other provider in town, like, who cares how long they wait? That is not the message that we want to deliver from this prediction, right? Because if we get to the other two, which are the next two on the list, both Copernican consumer, but more importantly, the funnel wars, it will be more important than ever to deliver a great consumer experience. Even if there's constricted choice, there still will be some choice. And most of what we're talking about with constricted consumerism is choice at a higher acuity level, so say with like surgery, right? And it's still important to deliver a great patient experience there. But the choice of where you go for urgent care in some cases may have even greater import for health systems, because that's an entry point, and that might dictate where that patient receives care for the rest of their lives. So we're not talking about that here necessarily. We might get to that in the funnel wars, but we would 100% continue to advocate, keep working on convenience, keep working on access, keep working on transparency. All of those things that should come forward from consumerism, we still think are really important. We would just like the industry to work harder, maybe to allow those to have more import through choice.
Great, and really thoughtful perspective there. And just to dig a little bit deeper, first, Sanjay made a great comment that if the outcomes, if there was a corresponding increase in focus and improved outcomes, then you'd be open to that constricted amount of choice. So that's an interesting thought. Also, question from David Perry just about the research process, which is around health insurance and brokers and how what their impact is to this overall choice picture that you're painting.
Well, two things. First of all, Sanjay, I think, is right. And in the book, actually, a lot of the people we talked to said, we're all assuming that choice is something consumers want. And at a certain level, choice actually is not what they want. They want comfort. They want confidence. If I don't need 8 choices for my hip surgery, I would prefer to have 2, that both of which are going to be great. So I think that speaks a little bit to what Sanjay's talking about. And to what David's talking about, I guess one way I would build on his question is, one of the things that was really interesting and brand new to me was this idea that in 2020, there was a federal decision around interpreting the tax code where up to this point, companies receive tax benefits from having a health plan for their employees. The interpretation was, hey, if you just gave every employee $10,000, that would also be tax deductible. And so some of these experts said, what you're going to see is the offloading of employer-sponsored plans, like the narrative talked to, where consumers will be just given a bucket of money to go out into the market, not dissimilar to what happened when 401ks started to emerge, which was really just a loophole in the accounting laws, the tax laws, where somebody said, hey, this actually would be a great retirement plan. It's now our number one plan, kind of the do-it-yourself plan, with obviously support from, in most cases, employers. And so to what degree will brokers play a role in the future? That depends on to what degree employers will play a role. And who knows how far that will go. But in the book, some of these experts talk about, we're already starting to see some employers take advantage of this. And most employers would say, I would rather just wash my hands. It's a risk. It's a mess. If I could just give people money and they still get the benefit of healthcare, I'd rather do that. So it'll be interesting to watch how quickly or how widespread that happens.
So next subject, let's go into our number 2 winner here. So constricted consumerism, that was 34% of the vote of what people consider the most important thing to be thinking about and building towards, but not too far behind at 26%, the Copernican consumer.
All right. Imagine it's 2030. You're me, a 50-something, and this disc I'm wearing, which it's probably impossible to see with the sweater I'm wearing, but I have a little disc right here on my arm. It's doing more than just monitoring my blood sugar. It monitors 100 health metrics, from my white blood cell count to my mental state of mind. Whereas my monitor today is noticeable on my arm, think 2 quarters stacked on one another, my 2030 monitor will be invisible to the outside world. It will connect seamlessly and instantly to my personal mobile device, which could be a phone, a watch, glasses, whatever. Thanks to blockchain, inputs from everything from my personal monitor to my EMR to my health plan records to my refrigerator and even my Peloton are instantly added to a holistic health record, available to anyone at any time I allow. Advances in genomics provides truly personalized medicine. So the biologics I use to treat my Crohn's disease are custom designed for my genetic makeup, and my insulin is engineered for my unique presentation of diabetes. 95% of the care I need is available to me wherever I'm at, whenever I need, at work, online, at the store, but mostly right in my home. My health coach makes regular house calls supported by a digital health platform that leverages AI and software-driven digital therapeutics to help manage my health on a real-time basis. Like so many others, I stopped seeing a primary care physician a few years ago. My digital twin will serve as a proxy for health issue diagnosis and potential treatment paths. As with other industries today, such as flying or checking out at the grocery store, much of my healthcare will be self-service, driven by my digital health support. And like so many aspects of my life in 2030, my work, my entertainment, my education, it all revolves around me, is centered on me, both in terms of where I'm physically located, but also who I am as an individual health-wise. Welcome to the first prediction, the Copernican consumer. So now, before we get any sarcastic comments in the chat, if you remember who Copernicus was from your astronomy class or wherever the heck we learned about him, he was the guy centuries ago who predicted the sun was the center of the universe. As we now know, he was wrong. But we love the idea of the Copernican consumer and everything revolving around them. And after all, this is a prediction, so we're fine with the irony of naming it after somebody who was wrong in their prediction. This is one of the more exciting predictions we have, I think, and maybe one that is not as surprising as the others. I think most people would look at this and go, yeah, this is coming. Is it going to come by 2030? That's the question. But you can see from Dr. Ruud, CEO at Geisinger, there are a lot of organizations that have made this really their vision for what they're going to try to do, whether that's health system wise, whether that's health tech, whether it's a service company supporting all of this. You can kind of see all the different elements that might be included there. One thing I think is important to note about this is we have, I've spent 20 years really working within the hospital and health system space. And the idea of patient centricity and consumer centricity has been around a long time. But really, that has always referenced when people come to us, they come to the hospital typically, or maybe they come to the clinic. How do we surround them with an experience that's personalized to them? This is really a fundamentally different concept where everything that's related to health is centered on the individual, where he or she is, where he or she sits, where he or she lives. And that's really a completely different model than what we've been trying to attain and what's not always the greatest success in terms of patient centricity, right? You hear a lot about dispersion of care. So this goes all the way back to Clayton Christensen, who I referenced in the book time and time again. 10 years ago, he wrote The Innovator's Prescription, which was his follow-up to The Innovator's Dilemma, all about healthcare. And he said, look, if we're going to succeed in the healthcare industry and not go bankrupt, we're going to have to see things that happen in the hospital move to outpatient, outpatient to doctor office to clinic, clinic to retail, retail to home, home to virtual. And we have seen that happening. And of course, COVID-19 accelerated a lot of that, which is super exciting, right? So we're going to see more and more of that. Blockchain, I am not a blockchain expert. I know enough to be really dangerous, but I know the promise of it. And we actually have a LinkedIn group that you can go find where we're talking about all these things. And Alan Shoebridge, who some of you may know, I think maybe even today or yesterday, said, how is all this going to be connected? And I think things like blockchain have the potential to take all of the data that I mentioned, that narrative, and bring it together. And a great way to think about this again is to allude to the financial services industry. And a personal example of mine, like many of you guys probably, I had a financial planner for forever to help me kind of particularly manage my retirement investing, but also how I save for my kids' college, how I save for my own personal savings, all that stuff. But it was something where I would see her twice a year. It's for an hour. She could barely kind of manage all the questions I had, and then I would go away. And in about a year ago, 2 years ago, I switched all of my investments to a company called Betterment. There's plenty of platforms out there. It's online. Basically, it's just an index-driven investing model. It's not active investing. If you're like me, I'm not a day trader. Just set it to the S&P 500 and go. And there are experts there to help me. I don't have a financial planner. It's about 1/10 of the cost of the financial planner I was using before. And it pulls in through API and other sources all of my financial information, whether it's part of Betterment or not. So my bank accounts, my 401k, which is run through my company, my wife's 401k, my 529s. So it's all in one place. I can go on there. I can manage it myself. If I need expertise from their people, they have the full picture of everything they need. Think about that and apply it to the primary care doctor and where we could be going with healthcare. Similar experience with my primary care doc, right? See him twice a year. He has about 45 minutes. No way in heck he can help me with all the things I need to help with. So he touches them about 5 minutes each, and then off I go. Imagine that I had a betterment-like solution for my health. And the implications of this are pretty significant, right? If that came true, we wouldn't need as many primary care docs. We might see what we call the barbell effect, which is already happening in the radiology field, where AI, as an example, has really supplanted a lot of what, though not everything, radiologists can do. So radiologists are moving to one end of the spectrum or the other. They're becoming more focused and specialized, or they're becoming even broader in what they do, because there's a middle ground where technology and AI can do what they do, right? So same thing with primary care and other areas of care. So that's the Copernican consumer. Let's have at it, Chris.
Sure thing. Yeah, let's dig into it, because I think that people have started to dig into the Copernican consumer concepts before the constricted consumer one. Got this question. There's a couple I want to address, but got this one earlier from Zachary Griffin, which was in regards to it's that he agrees with the idea of the Copernican consumer in spirit, that there's we're amassing more and more data points that paint a deeper picture on who we are and how we should respond to that. But there's a disagreement there. Disagrees that that would necessarily result in a reduction in demand for primary care. The vision that he laid out is, what if the PCP is working alongside the person, helping to parse those additional data points, helping to use those as additional points to guide them with their care. So curious about your impact, because again, there's no marriage to any of these predictions or suggestions. How does that jive with the research that you've done on this subject?
Yeah, I think it's a great point. And, we're making a pretty bold prediction about, well, we'll need less primary care physicians. I think it could go the other way. But also imagine this. Don't imagine, it's already happening. Amazon is getting into this space, right? They've gone national with their virtual care. They've just announced they're opening 20 kind of prototype stores around the country. Amazon has the scale to do what I suggested in a betterment type format for healthcare. So Amazon will employ primary care doctors, but imagine how many more people one primary care doctor could serve through a technology-driven online platform than could happen now with the in-person, situation we have with primary care. So primary care is not going away, but will we need as many? Will my relationship be different? Do I need to see the same primary care every time? That's where scale helps, right? So does it really matter to me that if I come back in with an issue, that I'm talking to somebody different, if they have a full picture of my health and that's supported by technology and software? I'm not sure it really does. I mean, that kind of infers that my primary care doc today always has the full picture of me and always remembers it when I walk into his office. That's normally not happening. He's looking at his EMR to remember everything, right? You can't expect that of a doctor. So I can see it both ways, but I do think there's a real potential for a reduction in need for individual primary care physicians, where scale can help provide it even to a broader audience and maybe in a broader way.
So thank you for that. And another question that we're getting is around like the overall impact on access. Basically, this one came from David Perry, but it was around if technology, if having this additional technology and data points available, and like suggestive or prescriptive technologies from other sources, does that allow the PA/nurse relationship to answer more questions and involve more deeply, and overall reduce the cost of how that care and how those conversations are delivered?
Yeah, 100% think so. I really do think that it enables the non-medical doctor to step forward in even greater and broader ways than they're able to now. Because the assumption here is there's more data, right? So if you think about all the monitors and stuff that provide the data, there will be some kind of technology platform, AI driven or not. Chris, you could probably speak to that better than I could. But certainly that would aid in a nurse practitioner or a physician assistant or somebody else providing a lot more care than they would be able to today, potentially. So I definitely think that that is part of that future.
Great. And this question might get reflected back to me, but I'm going to ask it. It came from an attendee before at registration, but it was around what AI solutions should be conventionally adopted in healthcare and what's on the horizon. And it goes deeper, like what goals are meant to be really achieved with AI in healthcare, and how can it be executed at a system level?
Yeah, so this is where I raise my flag of saying I am not an AI expert, but somebody else here is. Do you want to? You're right. Do you want to answer that? You can answer it better, but probably better than I can, for sure.
I'll throw it, like you gave the initial support to that answer by talking about the web of devices and data that will be actionable, just based on the Copernican consumer concept. When it comes to what's on the horizon and what should we be focused on adopting, well, right now within digital health, there's a whole slew of various point solutions. One of them you referenced in your book, Wobot Health, like all kinds of different things that come out using various aspects of AI and things like that. But it's one of the AI to me is so broad a term that I hate to go up here and say it depends, but what I really want to give you is that rather than focusing on AI, the technology itself, like I really think that AI should be embedded in a lot of different processes and tools and things like that, which rather than looking at AI as like the separate unit, separate entity, I kind of look at it as I look at my cell phone. My cell phone, it wasn't advertised or sold to me as an AI device, but it uses AI to do things like enhance the pictures that I'm taking, predict text messages and things like that. So it's a matter of embedding predictions into my workflow. So the things that we should be looking for within a healthcare context, because let's say that there's apps designed, for example, to help people manage their mental health or mental health challenges. Well, there's a couple of ways that could be delivered. One company A could take an approach of we have these natural language processing experts that go in and parse all this text and then like feedback a result, and consumers can use that. And we're trying to replace the therapist with a cell phone app. There's one aspect, but then there's the other type of company that involves clinicians in the types of predictions that they're making, that focuses on having the human in the loop and relying on the domain expertise of medical experts, and also focuses on making sure and working with those same constituents to make sure that the results and suggestions that they're making, predictions that they're making are ethical and valid. So it's not what choice of technologies, what services to focus on, I would say depends on your overall health system strategy, but working backwards into that by identifying like when you're choosing which of these technologies to if there's competing company A, company B, company C, then what should dictate that decision is their focus on working with clinicians or working with end users so that these algorithms and things like that actually get adopted and used. And also their focus on whether or not they're perpetuating, like one of the topics you brought was disparity, dystopia. Is this vendor, is this partner potentially, like, are there algorithms, are there approaches, are there problems that they're solving actually perpetuating bias and perpetuating right. Unethical uses of data? So the technology and path depends on strategy, but there's some very distinct, clear criteria that you can start using to be able to say, well, this approach is better than this other one. So
that's great. I think you're making a great argument for your own book here, Chris. So just keep that in mind.
Okay, well,
that's not already happening.
Let's partner up on that. Chris and Chris work together. I like that.
Yeah. Do we want to try to squeeze one more super quick? We might not have a lot of time for questions, but it is the one that I think is maybe the most, not the most controversial, but I think one that, particularly if you work for a hospital and health system, you most need to hear, and that's the funnel wars. You think we have time to squeeze it in quick?
I was hoping you'd let me guess because I knew it was going to be the funnel wars. How about we do this? We do a taste of the funnel wars because we only have a few minutes left, but maybe we can plan on a future talk that's more dedicated to that topic.
The funnel wars. So again, let me just really quickly kind of explain what we mean by the funnel. It's not too too difficult of a concept, but it can be confusing. Think of a funnel, like a triangle, and it's an acuity funnel. So in general, people enter the healthcare system at the top of the funnel. So think urgent care, emergent care, virtual care, retail care, health even, and also sometimes primary care, right? That can be right up there. And then they tend to funnel down depending on their condition and their situation. So they might move down to specialty care, surgical care, tertiary care, quaternary care. Most hospitals and health systems are rightly focusing their business on the middle part of that funnel, because that's where the financial model makes sense. That's where the surgeries and all of that support what they need to do financially. But what we know and what we've learned and what we know is that the top of the funnel is critical to filling the middle of the funnel, because it's a funnel, right? You don't fill a funnel by trying to force things through the side, you pour it through the top. And this is really important because all of the entrants and players that we've been talking about for a decade, they are all focused at the top of the funnel. And we have seen them trip and fall. We have seen them stumble. We have seen them come and go, but they are not going away. And this is really a race for the patient relationship. And this quote, I'm going to come back to it. It's the head of brand at CVS Health. I think is just phenomenal in capturing why this is so important for hospitals and health systems in a legacy sense. So just some things to think about. We have said for maybe a decade, Chris, hey, remember, you're not just comparing your brand, consumers don't just compare your brand to other hospitals and health systems, but they compare them to their favorite brands like Apple and Amazon. Well, now they're not just comparing your brand to theirs, you're competing with those brands. Top 5 Fortune 500 companies, 2 of them are 100% healthcare, United and CVS Health. The other 3, Walmart, Apple, Amazon, have all committed in a significant way to entering the healthcare space. Apple's CEO, Tim Cook, has said in an interview that when all said and done, Apple's legacy will be known first and foremost for its impact on health, which is crazy when you think about what Apple's known for now. You've got all kinds of new entrants and companies from Iora to Oak Street and everything in between with venture capital behind it. I mentioned before, you are now, if you're a legacy hospital or health system, competing against most of your payers in some way. Optum is a great example, who definitely is focused at the top of the funnel, but even goes further. And so what we learned from these experts, and one of them said, the risk here is for systems that aren't strong enough to survive this battle, is they will become what he said was downstream vendors of care. So almost B2B brands, no longer consumer facing brands, but utterly dependent on the patient relationship being referred to them from somebody else, Amazon, Apple, Walmart, CVS, you name it. It doesn't mean hospitals and health systems are going to go away, because most of these folks don't want your surgery. They just want the relationship at the top of the funnel because it helps them in other ways. They may be financially incented. If you're Oak Street and you've got an MA model where you need to own that relationship and you're incented to do so by United. And so if you lose that patient relationship as a legacy hospital and health system, you lose control. And that may force a lot of these systems to shrink in terms of scope and size. And so it brings us back to the prior slide and the quote. So when I asked Russ Meyer, and he wasn't the only one who said this, what do you think about this prediction? He said, the question isn't if this will happen, it's where and when. This will be market to market, but it's going to happen. It's inevitable. There's not enough space at the top of the funnel for everybody. Somebody's going to win. And he said, in my experience as a brand expert who has worked with the best brands in the world in my whole career, in and outside of healthcare, what I have learned is when companies try to transform, it is far easier to gain knowledge in that pursuit of transformation than it is to change culture. And when you think about the two sides in the funnel war, the legacy health systems, what do they bring to the table? Medical knowledge, expertise, physicians. They've been doing this for 20 years. All of the data, they own that. What's the other side bring? A culture that puts the consumer 100% in the center. Amazon, Apple, Walmart, CVS, all of those. That's just who they are. And his point is, if this is a race for the patient relationship at the top of the funnel, it's going to be easier for the one side to gain or buy the medical knowledge they need than it is for the other, and that's the legacy systems, to change their culture in a way where they are consumer oriented. And I think that's really profound and really scary if you're in the hospital and health system space, depending on who you are. Some systems will thrive, some are not going to thrive in the face of this. So that's a great cliffhanger, Chris, with 3 minutes left.
Y'all, really sorry to end this on a cliffhanger, but we'll have to plan future talks about this. There was obviously a lot of energy around this topic and conversation, and each of those 5 predictions is two of their own webinars. So we'll figure out a plan to get deeper on this stuff in the future. With that, just anybody who's interested in discussing these predictions further, or discussing strategy around where your health system might fit into this, and patient engagement strategies, you can reach out to myself or Chris, Chris Bevolo, or Chris Hemphill. I'll just say LinkedIn is the easiest place to reach me. Same for Chris Bevolo, so you can find us there. In addition to that, we're really thankful to have you on something supporting the forum and HMPS. If you've been looking lately, that they're coming back full force in Salt Lake City this year. So I would hope we'll be doing some talks there. So I would hope to meet y'all in person come mid-May. But just wanted to give a thank you on behalf of Actium Health, on behalf of Revive, and on behalf of the forum itself. Thank you very much, everybody.
Yeah, thank you, Chris. Thanks, everybody.